Today's lecture review is on Chapter 22, Hair Removal. Body waxing has gained a tremendous amount of popularity in the last few years. Hirsutis is the growth of an unusual amount of hair on parts of the body normally bearing only downy hair, such as the face of women and the backs of men. Hirsutism is an excessive growth or cover of hair, especially in women. The most common form of hair removal in salons and spas is waxing. But with the popularity of these services on the rise, there are many different methods that now are coming into play. Many men are now frequently requesting hair removal services. The nape of the neck, the chest, and the back are the most frequent removal requests made by men. You want to make sure that you complete a consultation. You need disclosure of topical and oral medications, disclosure of medical issues, and disclosure of skin disorders or allergies. When we talk about contradictions for hair removal, this can also include use of Accutane, blood thinners, chemotherapy, autoimmune diseases, prednisone use or steroid use, skin diseases, skin lesions, sunburn, if the client has had cosmetic surgery or laser skin treatments, if they have varicose veins, bleeding disorders, or other questionable conditions. Permanent hair removal, there are three different types. You have electrolysis, which is the electric current destroying the growth cells of the hair. We also have photoepilation, which uses intense light to destroy the growth cells of the hair follicles. And then there is laser hair removal, another method for rapid removal of unwanted hair. With electrolysis, current is applied with a fine electrode. It can be painful, it can be time-consuming, and it can become very expensive. It requires a special license. Photoepilation, also known as intense pulsed light, IPL, has minimal side effects. It requires no needles, so there is a reduced risk. It clears 50 to 60% of the hair in 12 weeks, but it does require a license to perform. And then there is laser hair removal. This is a rapid removal, best in the anagen phase of hair growth. The best response comes from coarse dark hair, but it requires specialized training as well. Discuss with your client temporary hair removal procedures. These include shaving, tweezing, depilatories, epilators, threading, and sugaring. Shaving is most common for men's facial hair, women's legs and underarms. It's quick and convenient, but it can result in irritation, ingrown hairs, and nicks from the razor blade. Tweezing is used to shape the eyebrows and to remove undesirable hairs around the mouth and chin. The natural arch of the brow follows the orbital bone or the curved line of the eye socket. Make sure to complete a consultation to avoid mistakes and ensure the client's satisfaction. When you're determining the best shape for the eyebrow, you want to take a look straight up from the nose, at an angle from the nose to the outer corner of the eye, and then a line going through the pupil of the eye. Refer to the chart that's included in your textbook. Depilatories are substances used for temporary removal of superfluous hair by dissolving it at skin level. It contains detergents, it contains adhesives, it expands hair, breaks down the disulfide bonds, and it requires a patch test. Many clients have severe allergic reactions and burning skin when using depilatories. Epilators can be wax, hot or cold, can be applied to the brow, the cheeks, the chin, the upper lips, the arms, and the legs. But there are safety precautions when we use wax. Make sure that you always test the wax temperature. Avoid wax coming into contact with eyes. Never, ever double dip into the wax pot. Never apply over warts, moles, abrasions, or irritated or inflamed skin. Use hard wax on sensitive skin and always apply aloe gel to calm and soothe the skin. Always remember to sunburn. We do not want to wax over sunburned skin. Another procedure is called threading. It's practiced in Eastern cultures. It involves the manipulation of thread. It's twisted and rolled on the skin's surface. The hair becomes entwined and lifted from the follicle, but also specialized training is required. Then there's sugaring, an epilatory treatment that produces the same results as hot or cold wax. It uses a thick, sugar-based paste. It's appropriate for sensitive skin, and the residue can be removed by dissolving it with warm water. So to review this chapter, depilation is removing hair at the skin line, such as shaving or using chemical depilatories. Epilation is removing hair below the skin line, such as tweezing, waxing, and electrolysis. As a licensed practitioner, you will be asked to remove unwanted hair, especially the eyebrows and the facial hair. If you should choose to specialize in aesthetics, you will want to become proficient in other hair removal services, as allowed by the regulatory agency in the state or province where you practice. It is extremely important to follow cleaning and disinfection guidelines when removing unwanted hair. You want to cleanse and dry the treatment area prior to the treatment and apply a cooling antiseptic afterwards. Please make sure to follow all safety precautions to protect the client from skin irritation and inflammation.